Hey guys, so just wanted to take a few minutes to discuss one of the additional procedures that we offer at Austin Plastic Surgeon, both in Austin and in San Antonio. That's the lip lift procedure. This is a fantastic procedure. A very dramatic appearance can be achieved without the use of hyaluronic acid fillers in order to augment the lip. This is done through a variety of techniques. Lip lift techniques have been described for almost 4 decades at this point. The deep plane upper lip lift, first described by Dr. Ben Talley in Beverly Hills and Steve Perlman, has been a fantastic addition to this technique, which really optimizes the aesthetic outcome by mitigating some of the risks that were originally associated with the superficial or bullhorn technique that was originally described with lip lift. The goal in lip lift is really to create a much softer appearance to the upper lip and to provide better facial harmony in the absence of or in the presence of facial disharmony associated with the perioral or the oral region. In deep plane upper lip lift is by shortening the cutaneous lip height. So that's the height between the bottom of your nose and the top of your lip, or the vermilion border. This allows for improved balance aesthetically for the entirety of the face, and it also improves sensuality when we look at this as a whole. Individuals that are going to be appropriate candidates, and then we certainly have goals when we're talking about deep plane upper lip lift. These include optimization of both the lip height vertically and horizontally to allow for optimization of facial aesthetics. Also, we want to provide appropriate amount of incisor display. That's display of those 2 front teeth during repose, which is just during a static appearance, and during smiling. We want to avoid a deep plane or superficial plane lip lift procedure in anyone who has excessive vertical height of their face, which we would assess at the time of their clinical examination, or has the presence of any excessive straining or the inability to truly close their lips at the time on examination. This procedure. So essentially, we determine our final cutaneous lip height. That's the height between border or inferior border of the nose and the vermilion border. We design our skin excision and our excision of the underlying structures to allow for a residual height that we are trying to achieve and to really improve those facial aesthetics and incisor display. When we look at this procedure, certainly we have lots of goals in mind. This is a fantastic procedure that really allows for improvement of sensuality in the absence of use of fillers. There are certainly individuals that are going to benefit from this, and then there's going to be individuals that are certainly not appropriate candidates for this procedure. That's all determined at the time of the procedure. But at the end of the day, our goal is to create a beautiful, gentle slope along the vermilion border, starting from the inside all the way out laterally. Provide for adequate exposure of that vermilion, that beautiful border between the red lip and the white lip, and to allow for elevation in the setting of depression of the angles or the corners of the mouth, or in the setting where the vermilion border, that border between red and white lip, where it's just depressed. Finally, we really want to create just beautiful symmetry and harmony of the lip. This is a procedure that can do it all. If you're interested or have any questions, leave your questions below or come and see us in consult. See ya.